bilateral expansile mandibular lesion is characterized by. This is a very simple single liner MCQ which has been repeated multiple times. See here, among these, if you see Paget, polyostotic fibrous dysplasia, cherubism, giant cell fibroma, giant cell granuloma, all of us know cherubism. Okay, but there are certain peculiarities you have to remember about the cherubism. First of all, cherubism is autosomal dominant. All of us know it is autosomal dominant. It is bilateral. That is a uniqueness. It affects both the sides. It affects both the sides. Mandible. Initially it affects mandible. Later it spreads to even involve the maxilla also. Okay. So it's a bilateral expansile lesion. Expansile lesion. So here you have to remember that it is expansile means it is even having radiolucency, multilocular radiolucency. Multilocular radiolucency. So the point you have to remember that this cherubism typically has got multilocular radiolucency, that too bilaterally, and it is expansile. So the lesion is expansile. What do you mean by expansile? The bones are expanding. That is the reason why, as the maxilla is expanding, the eyeball rotates upwards. That is why they call it as eyes up to upwards to heaven appearance. So it appears as if the child is looking up to the heaven. Eyes are rolled that way. Okay, that is a unique point of the cherubism. And this cherubism is here. That is why they call it expansile. Maxilla is expanded. Okay. Even mandible starts with mandible. Mandible is expanded. Except remember, all parts of maxilla and mandible are affected by this cherubism except condyle. So remember, condyle is never affected with the cherubism. Condyle is never affected. Here what we have to remember is condyle is never affected by cherubism.